A survey found that over 70% of nurses worry about workplace violence. This issue in healthcare often occurs from extreme behavior of patients. These situations are unpredictable, but unfortunately, they're expected by staff. Incidents should always get reported in the health industry so that hospital administration can handle them properly. If they aren't addressed, they can lead to reoccurring negative impacts. Hi everyone, I'm Matt from eTactics, and today I'm going to explain the cost of workplace violence in healthcare. Before we get started though, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit that alert bell icon next to it as well so when we post new helpful content, you get notified. First, it costs your hospital its employees. People who experience frequent violence will likely leave their jobs. Exposure to these situations increases depression, anxiety, and emotional stress. Burnout rates are already high and cause people to leave their jobs, so the stress of workplace violence doesn't help. When retention is difficult, you'll face a staff shortage, which only has a negative impact. Even if health workers don't leave their jobs, they'll still miss work from injuries if they need to use sick or disability time. This contributes to the next cost for your organization, which is financial. Turnover registered nurses cost hospitals between $5 million and $8 million annually. You'll be faced with restaffing costs, and you'll also have to pay overtime to fill staff shortages. But working overtime increases burnout, so this just contributes to the cycle of turnover. Even if an employee doesn't quit, hospitals have financial burdens. Injuries from workplace violence will require workers' compensation and paid leave time. A study found that injuries at large U.S. hospitals could cost over $3,000 on average per incident. Those who experience these injuries use around 113 hours of sick, disability, or leave time each year. This costs hospitals around $54 million annually. Finally, it costs your hospital the safety of staff and patients. By now, you already know that it's a safety concern for staff since they're the main ones who experience workplace violence. In fact, health workers have a 20% higher chance of being the victim in workplace violence than workers in any other industry. But they aren't the only ones who it affects. 80% of physicians said that incidents harmed patient care. This could be for a variety of reasons. The patient doing the violence could end up getting hurt, or another nearby patient could get harmed in the process of the violence occurring. When staff needs to handle these incidents, it takes attention away from other patients, and if violence leads to staff shortages, there is lower quality care across the board. As you can see, workplace violence in healthcare has many negative outcomes. It's an expensive problem financially, and hospitals can end up losing experienced staff. Even worse, it could impact patient care. Now, I'm not trying to scare you away from working in healthcare or visiting the hospital when you need to, but a solution to these issues is reporting the problems when they happen. Unfortunately, healthcare staff accepts that workplace violence will be a part of their jobs. This makes them less likely to report incidents. As little as 30% of nurses and physicians report violence, but if they inform hospital management, then these incidents can be managed and avoided in the future. If you'd like to learn more about workplace violence in healthcare, reach out to eTactics. And you already made this far into the video, so you might as well like it, share it, and comment below. Well, what are you waiting for? Subscribe to our YouTube channel.